My name is Shane Gillum. I'm a family medicine doctor in Stephenville, Texas.
Okay.
When I was in high school, I was a junior in high school. My dad was hit by a drunk driver, and he spent 3 months in the hospital, a month in ICU, and a couple of months after that in the hospital, then 6 months in a hospital bed in our living room. And that's when I first got introduced to medicine as just seeing what they do. And that's kind of when my interest was sparked. But then I went to Tarleton and didn't have much guidance coming from a small school, Lipan. So it took me a while to figure out that I actually wanted to go. I started out pre-nursing.
Oh, okay.
Then I changed my major twice. Finally, I got a degree from Tarleton in animal biology.
Awesome.
I graduated med school in 2002, so I got a license the next year, 2003, and then I came back to Stephenville in 2005 after residency. So I've been here, 12?
Yeah, 12
August
years.
to be starting 13 years.
Awesome. Okay.
Okay, so I went to Tarleton for more years than they let people go nowadays. About 7 years at Tarleton. But I nearly had a master's degree. So I went to Tarleton, graduated undergrad. I applied to med school the first year, but I didn't get in. So I got my application in late. And then I did some research and worked on my master's degree. And then got accepted to med school in I started in med school in 98.
Okay.
So 4 years of med school at UT Houston. And then graduated med school in 2002. Started residency in 2002 to 2005 in Waco at the McLennan County Medical Education and Research Foundation. And then graduated there and then came back to Stephenville.
Okay.
Well, at Tarleton, I took anatomy and physiology, animal physiology, microbiology, immunology. I actually took some plant classes as well, just kind of trying to fill out my master's degree, but mostly animal science type classes, chemistry, organic, physics, calculus, all of those things.
All the fun stuff.
Before I got accepted.
Oh.
Actually, there's a story behind that. I applied my first year that I didn't get in, but I got my application in the very last day that you can submit your med school application, which is a bad idea. Don't ever do that if you're trying to go to med school. I interviewed at UT Galveston that year. The next year I got my application in the first day, and I interviewed at all the med schools in Texas. But I told Misty that, we were talking about it on the way down to Houston, that we did not want to live in Houston. Didn't want to go to med school there. But turns out that's when they offer you that position, you go where they accept you.
Yeah, definitely.
So some people probably could be choosy, but when you're going to med school, especially in Texas, the med schools in Texas are all good. So you go where they accept you. I had one interview there. A psychiatrist interviewed me, and it was a horrible interview. I thought it was. She raked me over the coals. But then I went and talked to a guy that had come to Tarleton. They're a recruiter. I'd met him here, so I went and found his office there and talked to him for an hour or two. Turns out he was on the admissions committee, and so I think that helped he was having computer trouble at the time. And that's what I actually did for a living when I was going to Tarleton, I did computer work, repair, and so I helped him with his computer problems, and I think that helped. It certainly didn't hurt. So
yeah, definitely.
So I got accepted to Houston, so we went to Houston. Well, I thought I wanted to be a surgeon. That's what I went to med school thinking. And then in third year of med school, we do clinical rotations. My first clinical rotation was trauma surgery, and Dr. Red Duke. You ever heard of him?
No, I don't think
He's
so.
he's famous down there. He died last year, I think, or 2 years ago. He was really famous though. He was in residency at Parkland when JFK was shot.
Oh.
So he actually worked on JFK.
That's
But
awesome.
down in Houston, he was a local legend. So I was on his team. He was the chief of that trauma surgery, and boy, the surgeons' attitudes really turned me off.
Mhm.
They're all really arrogant, and subsequently I saw other surgeons that didn't act that way, but
Mhm.
it changed my mind right away. I said I didn't want to be that way. So,
Mhm.
after you do multiple rotations, you kind of get to decide. On fourth year, you get to decide electives. So,
Okay.
family medicine, I get to do a lot of things. So
Mhm.
that's what I like, just
Okay.
the variety and I never know what I'm gonna walk into and
Mhm.
see. So.
That's true.
I'm the medical director for Summer Sky, and an
Oh,
alcohol
okay.
and drug rehab
Okay.
treatment center. So I do addiction related stuff. I actually worked there when I was going to undergrad, and then I did in Waco, my third year of residency. I helped run the Freeman Center, which is just an alcohol and drug detox center in Waco. So.
That's cool. Okay.
Well, when I was going to Tarleton, we had seminar class which we could volunteer in the ER. We could go there, well, observe really, and then one full summer, I volunteered in the OR here at the hospital, and just got experience that way. Those are the main things I did before I started med school.
Mhm.
Hard.
It's hard.
It's
Mhm.
work. But you're at least practicing. You're not just, it's not all books all the time.
Mhm.
Residency is the hardest part of becoming a doctor. They've changed some of the rules now. Actually, right after I graduated, they changed the rules on how long residents can work. Now they're changing some of those back. But we'd work 2 or 3 days in a row without sleep. It was brutal.
Oh gosh. Mhm.
I've fallen asleep standing up before.
Oh my gosh.
Just in the ICU, laid up against the counter, just boop, go to sleep. So they don't. I mean, that wasn't all the time, but I mean, there were sometimes. The hardest night I ever had on call in residency was my first night of my second year. So your intern year, you're always backed up and supervised because you're not licensed yet.
Mhm.
Day one of your second year, you're basically by yourself.
Mhm.
You've got backup, but they're not in the hospital. So I was on OB because I'd finished a month of OB in first year, and I started my second year with OB. So I basically stayed on the same service, but one day I had backup, and the next day I did not.
Mhm.
So the first day of my second year, I was on call for OB.
Mhm.
I came back. I'd been in clinic all day. I came back to the hospital, and I had about 6 or 7 patients laboring. I went to dinner with Evan and Misty down in the lounge at Hillcrest, and they called me. And there was a woman in labor. That she had a previous C-section, but she was trying to have a vaginal birth after cesarean VBAC. She was laboring, and they called me and said they could not find the baby's heartbeat. So of course that's an emergency.
Mhm.
So I went up. So I went up to the floor and checked, and the head was not engaged. And I just checked her less than an hour previously. The head wasn't engaged, no heartbeat. So that's a surgical emergency at that point. Figuring out what happened to the baby. Where is the baby?
Mhm.
So I called my attending, who was probably 5 or 10 minutes from the hospital. He said, get her to the OR. So we had her in the OR, and he was on the phone with me telling me to go ahead and start cutting. So I started cutting, got the baby out. The baby was in the abdomen because the uterus had ruptured along the previous incision. She didn't bleed, which is a big deal because she could have, the incision could have extended laterally into the uterine artery, which then she could have bled to death in a couple of minutes. But we got the baby out. She ended up being fine. Baby was fine. But that was the start of my second year in residency. The first day of my second year was the beginning. We ended up having 9 deliveries that night. 4 were C-sections and 5 were vaginal births. So that was my indoctrination into being in the hospital without backup. By myself. No pressure. No, 3 years of family medicine residency at Waco. Well, I usually get up every morning around 5 a.m. and log onto my computer from home and start catching up on messages and charts. And then I'll either come to the clinic, to the office. Well, most mornings I go to Summer Sky first, the alcohol and drug rehab program or facility. I go there, see patients there, and then I come to clinic. So I'm in clinic all day, either seeing patients in the rehab program or in clinic here. I don't do hospital work anymore. I'll go see a baby every once in a while when they call me, but they have hospitalists, so I don't. I've got more than enough to do.
Very good.
So we admit alcoholics, addicts, so heroin, meth, cocaine, anything you can think of, and usually it's the combination of all of the above. So when they come in, they call me. I have to give them orders, then I have to see them within 24 hours. I had to admit them and detox them. And then sometimes they'll stay there 30, 60, 90 days. And I will check them, once or twice a week, or if they need it more, I'll see them. So we have like 30 right now. We can hold as many as 50, I think. So this time of year, it's a little slower. Starting to pick up now because deductibles have to be met at the first of the year.
Oh.
So by the time people start meeting their deductibles, they start coming in about this time of year because they've been met now. So it starts getting really busy. Last year, late summer, we had I think 50 over there. So I'll go in to see 20, 25 people over there in the morning. It's kind of nice. I sit in an office over there, and the techs bring the patients to me. So it's a little faster than just going room to room to room. So anyway, they have a lot of psychiatric issues over there too. So and so I end up diagnosing psych problems, and because we don't have a psychiatrist in this town. So
There's not one?
oh no, there's not a psychiatrist anywhere close.
Oh.
Used to be one in Weatherford, but now Fort Worth, and it's hard to get in to see them. So because most of them just take cash. So I get to be a psychiatrist too. Oh yeah, we had psych. I did psych in med school, and then in residency we did some psych. But a lot of it's been on the job training, just by force of having to do it.
Having to do it. Okay.
Let me think. Golly, I don't even know the answer to that question. Well, like Monday through Friday, it's usually around 12 or 14 hours a day. And then the weekends I'll work, well, some weekends I'll work, like on Sunday, sometimes I'll come over and work 5 or 6, 7 hours charting.
Mhm.
And then I have to go to Summer Sky on the weekends as well. So that's where I'm going right after
Right.
this. So, I don't know. That's a lot of hours, right?
That's a lot.
Yeah, I don't know.
More than normal.
But that's pretty normal for physicians. I
For a
mean, it's
doctor.
not, yeah, you don't, there's not really any stopping. I mean, people are always coming. You can't, you really have no control, honestly. I mean, I have a little bit. Like here, I say I can only see this many people in a day. There are doctors I know that can see twice as many as I can. I just don't feel comfortable, and plus I'm worn out if I see. I usually set my limit like in an afternoon clinic here. I'll start at noon and go to 5, and I'll see 20 to 25 in that 5 hours. So, and if I've seen 15 or 20 over there, that's enough.
Yeah, that's a lot.
That's about all I can do. So,
Is charting a lot?
Yes,
For
it's
each patient?
excuse my French, it's a pain in the ass. The computer has not made it easier.
It hasn't.
No. Theoretically, well, yeah. Theoretically, it should, but they didn't design computers around our flow. They designed computer and said, doctors use it.
Yeah.
So they didn't come and say, what do y'all need? So, yeah, I'm not a fan. Computers one. And I have a background in computers. I'm computer literate. I built them, repaired them, and all that in college. But they make our life harder because the information, any computer system, the information is only as good as what's entered. So, and the second thing is insurance.
Oh,
I hate insurance companies.
having to deal with them. I think everyone does.
It's, they're not interested in healthcare. They're interested. They're to make money, and I understand it from a business standpoint. But yeah, dealing with insurance and getting paid. I mean, rates. My reimbursement over the last 6 years has gone down every year from insurance companies. What they reimburse me for a cert. So when I see a patient, I code a level of service. Depends on the complexity and how many problems we deal with, that kind of thing. So usually they're a level 3 or 4 or 5. There are levels 1 and 2, but those are nurse visits. So a level 3, 4, or 5, I'll code according to the complexity. But my reimbursement for each of those levels has gone down consistently over the last 5 or 6 years. So in order to make up for that, you have to see more patients. So, which is not good for patient care, to rush them through more. So anyway, that's why I'm not a fan of. Yeah.
That makes sense.
Well, this sounds cliche, but when you help, I'm helping people. When they get better, especially like in rehab, when they come in, they're messed up. They look horrible. They're in shambles. But when you see that change and them getting better, and especially when they leave the facility over there, they look like a totally different person. And that's a big reward of it. Plus here, you see the same thing. Here when you can't help everyone, but sometimes people aren't just grateful about it. But most of the time, people are grateful. So no, it is rewarding. So plus it's financially rewarding.
That's true.
It's not it's not like I'm going broke. It just
Yeah.
A few things I would say. One, figure out if that's really what you want to do, because it's a lot of work to get to this point. So that I would say try to shadow a doctor, at least see what their life is like. And then if you are applying to med school, get the applications and look at all the blanks they want you to fill in so you can answer all the questions. So you want to do some volunteering, you want to do, they want you to be well-rounded. So a lot of times they want you to do research. I don't think it's that important to do research because most doctors don't end up doing research. That's what the guys in med school say, because most professors do research because that's kind of how they support themselves. But in the real world, most doctors do not do research.
Yeah.
But so I would say, figure out if you really want to do it before you commit all this time and money to school, because you may get in and decide this is really not the way you want to live, because the hours are long, and depending what specialty you go into, you may end up, like OB, there are a lot of sleepless nights even when you get out of residency. So you got to decide if that's really how you want to live.
Okay.
Practice tests.
Okay.
Take practice tests, because there's a lot of information, and it's an 8-hour test, or used to be. The main thing is figuring out how to, one, take that test and be able to, the stamina of taking 8 hours, sitting for 8 hours and testing. So I would say practice those tests. And there's a lot of programs, Princeton, Kaplan, they have, they simulate MCAT, so you can go sit and actually act like you're taking one. So I think that's the most important part. I mean, of course, the studying, but you really need to practice.
Practice doing it.
Practice doing it.
Okay.
Well, one, I'm kind of a nerd. I liked microbiology because I think it was one of the most interesting things. And then I took a class in my master's level. I took mammalogy, actually, a mammalogy class. It was a really cool class. We went on a field trip and trapped animals, trapped mammals, and yeah, it was a really cool class. So it incorporated a lot of what we'd already learned to that point, biology-wise, and so I just enjoy all the biological sciences. I'm not much of a chemistry fan, honestly.
That's how I am.
Yeah, organic, I hated organic. 2 semesters of that's enough. But all the biologies, microbiology, immunology's good. Animal phys was one of my favorite classes, just because of the lab in that. You can do some pretty cool stuff. And then A&P is a good class too.
Oh yeah.
And I taught A&P labs for 3 semesters at Tarleton.
Oh, that's cool.
After I graduated, after I got my bachelor's, and I was going to working on my master's, I worked as a graduate assistant and taught A&P labs, which was very helpful in med school, actually, because anatomy and physiology is gross anatomy is a whole year, so it was good to have that background.
Yeah, that's awesome. Today,
Oh yeah,
you just said it did.
yeah, it's the basis of. I went to med school with people who did not take biology. They did not have a biology major. They had a lot harder time in med school because they were learning things they'd never been exposed to, really.
That's true.
I would not recommend going to med school without some biology background. I think they make you have a certain amount, but
They have some required
courses, but you can major in anything, and then but they had a lot more difficult time. And I'll tell you, Tarleton, I think, prepares as well as any of the. I went to med school with people from like some of the Ivy League schools, and they were not very well prepared. Classes I can't remember, but some of the classes I had at Tarleton were med school classes were basically the same. They were just rehashing the same information. Well, yeah. I mean, medicine deals with biological systems. So, as a human being, we have lots of biology going on. So, I think it still applies on a regular basis. Physiology is a part of that, but that's still biology.
Yeah.
So, I think it's used every day to some extent. Yeah. You're always learning something. There's always something you don't know, or should be reading all the time, as these stacks of journals attest.
Oh my gosh.
Well, I get them and I look at them and go, oh yeah, that's a good, I need to read that article, and I'll scan it and then I'll stick it over here. So,
There's probably so many.
yeah,
Literally.
look, I mean, that's, yes. Every week, I mean, I'll get, that's probably just one day's worth. We'll get sometimes 2 or 3, 5 a day of different articles. And not all of them are good, but this is a really good one, the Family Practice News. So, yeah, I'm always, I always bite off more than I can chew. But I hate to throw those away because there are good articles in them. You can go look them up online, but sometimes it's good just to open up a piece of
Read
paper
it.
and look at it versus trying to read it here. Because this, I can fold it back and, you know, open it up and I can leave it where I was at. And
And
here,
remember.
yeah, but here, I'm, you know, you got multiple tabs. I don't know. It's just not as good. So, anyway.